Welcome to Wondermous, a podcast, a leadership healthcare journey. My name is Merikay Hunt, and today we have Tyler Smith. He is the CEO of Health Data Movers. And Tyler, why don't you tell us a little bit about your organization and your leadership role?
Sure. Yeah. Appreciate it, Mary Kay. Great to be talking with you today. Like you said, I'm the CEO of Health Data Movers. Our vision is to be healthcare's most respected technology services firm. We work with the top healthcare systems, biotechs, and digital health companies across the United States, providing excellent quality technical services. And we've been in business for a longer time than I can believe. We've been working with customers under the HDM brand since 2017, and some of our customers go back to companies that were founded in 2012. So
Wow.
yeah, it's really cool to be talking with you today, and happy to dive in.
Awesome. Well, and I'm always inspired by hearing about people's career journey. It seems like sometimes every opportunity is kind of a stepping stone to their leadership success. So, can you give me a brushstroke of your background in healthcare?
Sure. So I graduated college in '09. I went to school in Nashville, so there was already some healthcare. Uh, I guess there's a big chance I'd end up in healthcare. I actually went to work on Capitol Hill,
Okay.
and it was a really cool time to be in DC because that's when both healthcare reform and Dodd-Frank were
Mm.
passed. I actually kind of leaned more towards banking and finance when I graduated, and that was kind of the path I assumed I would take. And
Okay.
working on the Hill was an excellent exposure to healthcare from a
Mhm.
legislative perspective, and luckily, my next pursuit after 1 year was with a healthcare technology firm. I got certified in Epic in 20, I
Uh,
think my journey in 2010. So right when meaningful use was kicking off. And yeah, spent about, I don't know, 7 years as a builder, which was an incredible experience across different Epic applications. Got to work with some amazing organizations. And, when we got Health Data Movers going in 2017, kind of stopped building, burned some
mhm.
lifeboats, if you will, and just moved over to the business side. And that kind of takes us to where we are today with a lot more in depth, actual storylines that go on. But, that's kind of the broad strokes.
Oh, that's awesome. Well, I'm glad you mentioned Epic because I've been in this National Society of Certified Healthcare Business Consultants for 23 years. And this morning on the listserv, one of the consultants needs an Epic consultant. So when we're done, I'm going to
Sure.
find out some potential contacts that you might have that'll help me.
Oh, yeah.
So having connections and building relationships is often a theme to build business. What do you think has been one of your strengths to help you build relationships to build business?
Sure. And healthcare is so much about relationships
Mhm.
and strengths. Um, I thoroughly enjoy getting to know other people,
Mhm.
regardless of whether there's going to be an immediate outcome from a business perspective or if it's just a longer term relationship. And so I think once I sort of realized that, I don't know how old I was, but at a certain point in your career, you realize that it really is just about being human and being who you are around
Right.
other people, and that will pay many more dividends. They may not be apparent at the time that you build a relationship or nurture a relationship, but that
Mhm.
is truly how you build authentic and genuine relationships.
Well, and the authenticness of you and the genuineness was. I remember from one of the questions I said, I was like, "Are you a morning person or an afternoon person?" And your team member said, "He's an all day person." So that speaks a little bit, I think, to your energy level and your passion and your drive. What do you think has been one of the biggest blessings or the biggest accomplishments? And then I want you to also share one of the biggest challenges that you've experienced in your career as well.
I think one of the biggest blessings is getting plugged into the Epic ecosystem at a really young age
Mm-hmm.
and being able to be here while our country and the world is largely digitized
Right.
health.
Mm-hmm.
And I don't know that there's any way that you plan for those events in your life. And so, yeah, just very grateful. Really grateful for what Judy Faulkner has created, this enterprise idea around EHR, was not, the prevailing mindset, 15
Right.
years ago. And so grateful to be part of the ride, and grateful to work with excellent people. I think that having an incredible business partner, like a leader that I've gotten to work with in the form of
Mm-hmm.
Greg, who's our president, again, it's hard to tell how you make all these things happen. And so it really is just some form of grace.
That's great. And so I like to focus on the positive and purposefulness of natures, but oftentimes we can learn so much when we talk about our challenges or when things really didn't go as well as we wanted. So speak to one of your big hurdles or obstacles that you've had in your career.
I mean, I think it's every day. It just depends on what hour you catch me. Um, I think I think a lot of the learnings go back to controlling what you can control, and then on the flip, having the wisdom to know the difference.
Sure.
And so there are specific examples, obviously, of like bids that I wish we had won, or maybe directions that I wish we had taken.
Hmm.
Um, and maybe if yeah, you're asking for specific examples, so I won't speak in total hypotheticals. Um, a couple of years ago, we had this mindset, and I think this is pretty normal for bootstrap services businesses, where
Hmm.
you want to serve every opportunity that comes your way, because that's
Sure.
how you survive. You are only as good as like the next 3 months essentially of
Hmm.
work that you're able to sign up. However, the danger with that is you can become, the old cliche of jack of all trades, master of none. And I think a couple years ago we had a couple more service lines. We've got 4 service lines now: data
Okay.
management, integration, project management, clinical and business applications. But we
Okay.
had a few others, which, um, we were capable of delivering excellent work. However, at a certain size, it really saps focus if you're
Hmm.
trying to be everything to everyone. And it was a
Mm.
hard decision to decide to cut 2 service lines.
Sure.
However, sometimes the best part about being bootstrapped and being in it is that you're left with no choice. So even though, that was about, I guess, 2-ish years ago.
Hmm.
It was a challenge, and it was hard, and it wasn't a fun decision to make. On the other side, it's easy to look back and say, well, we made the right choice, thank God. But
Right.
that's not a guarantee. And I think that, just learning how to stay focused, even if it means cutting off what you feel are necessary extremities, to make sure that the whole body continues to survive.
Well, and it reminds me of the old business principle, less is more, right? And
Mhm.
when years ago, when I was first starting my speaking career, we had the North Carolina Speaker Association met in Charlotte, and it was the South Carolina division, North Carolina. And one of the things they really helped us focus on is, pick your lane and go deep in your lane.
Sure.
Well, some of us might have had, 3 lanes, right? But be experts in those 3 lanes, because just like you mentioned, you could have 5 products, but if really 3 of them are supposed to be your sweet spot or your focus or your Y factor, spending the energy on those so you have 3 great ones instead of 5 okay ones. So, what helped lead to that decision? Was it more of a revenue piece or more of a product piece? Just curious.
Well, essentially, we were blessed in that we had really stepped up our game in our
Mhm.
forecasting and
Mhm.
reporting. We
Mhm.
brought on amazing, finance. At the time, I'm not sure what his title was. Now he's a director of finance, Ryan Lieberman,
Mhm.
and he brought a lot more clarity, and so we could
Right.
tell by the numbers. So to your question, um, the immediate need was, oh, we have to right the ship. If we talk more about the strategic, we've been blessed also with an amazing actual board of directors since
Mm.
2021, and they've been kind of hammering us with the lessons that you're, stating. So it
Right.
wasn't like we didn't have access to that wisdom. I think
Sure.
the tricky part is when do you have access to the actual ability to make that decision and be willing to take responsibility, because indecisiveness a lot of times is easier, right? It's easier not to do anything.
Sure.
So it really was just using our value of growth mindset to make it happen.
I love that. In fact, this afternoon I'm kicking off a virtual leadership and coaching series, and we're featuring Carol Dweck and her mindset book,
Yeah.
and talking about, how
Yeah.
in business, whether we're in healthcare or we're in for-profit, nonprofit, having that growth mindset, willing to try things, even
Yeah.
if we fail, that's going to help us go to the next level and learning from it. I think that's the other key. And I'm glad to hear that you guys have a leadership forum, of the board. And also it sounds like, I don't know your key leaders, but, having the collaboration, the open communication, the dialogue, and being willing to say, you know what, that ain't going to work. We're going to have to try something else.
Yeah.
But I think that makes it rich too. So, and the other thing that I'm sensing as a theme is that you all have passion and purpose for what you do.
Sure.
And making the impact on the patient experience. So tell me a little bit about how your products and services are really transforming and innovating and helping the patient experience.
Sure. So, and that is probably something I should have mentioned on where I've been lucky is, when we work in healthcare, it's necessarily altruistic. And
Sure.
so to have to create that alignment amongst our team
Mhm.
is easier in a lot of ways than it might be in other industries. And so, yeah, I love the question about product or service. Essentially, when we started off, we were doing services with the idea that we would build a product. And that had to do with the time. It was 2017, and everybody really believed like product was everything, service wasn't sexy, for lack of a better word. And so
Right.
we really wanted to build a product. However, what we realized in doing that was that our services business was doing really well. We were getting great marks. A couple of years later, we would win best in class.
Mm.
And so, kind of answer like the business point. The business point is we learned that like we do what we do well in services, and then mapping it back to healthcare. Our mission is to empower patients and providers by unleashing the potential of healthcare data and technology.
Mm-hmm.
And so, while we have that vision to be the most respected, the mission is like why we do what we do. And so we
Sure.
point back to that mission consistently. And look, my sister is a physician, her husband's a physician. I think we all have frontline workers in our lives, and what they do is, I mean, it's probably the most sacred work you can do in healthcare, and maybe even in this world. But they also need like incredible backup in terms of they need the right data, they need systems that work. And so, even though we may not be directly touching the patient or directly, touching the provider, we are providing like the necessary infrastructure and information for them to perform at the peak of their license. And so we try to remember that as much as we can
Sure.
as we go through our day.
Well, and ease of use. One of the physicians I interviewed a couple of weeks ago, he said, Merikay, some of this technology is making my life less stressful. So when they can use it easily, it's quick, it's efficient, they can rely on it, it gives them the confidence, to be able to assess. I think that's a huge, huge testament to the product. And the other thing that I'm thinking about is if you have a great product and a great service, then that word of mouth factor is going to happen too, because testimonials from your current clients that can leverage and help support you as you continue to grow whichever market share you want to go in. So
100%. I mean, it's a very small healthcare world, even smaller Epic world. And everyone who's been in it for a while has that understanding. And so, yeah, we also remind our folks about that. Just not that they need the reminder, but so it's like every time we have a couple of mantras across our company, delivery delivers. And
oh, I like that.
yeah, so it's relatively obvious, if you will, but just restating that is, in like the execution, like we make it clear that yes, we have a client services team that's responsible for selling, but if delivery delivers, like that makes it much easier for the sales process. And so having these kind of underlying objectives about really, execution and becoming most respected ensures that we're able to perform that work. And then, we get those referrals ideally.
Gotcha. So I'm a big on goals and visionary, like for the future. So think about the next 2 to 5 years. What do you think is going to continue to help your business be strong, help this technology piece, so that where are we going to be in 2 to 5 years?
Yeah. Well, it's hard to predict the future these days with the pace of change. I think like in 2023 was that when ChatGPT came out. I remember sitting where I was. I think I was sitting in the car and I was looking at what ChatGPT was able to do, and I was like, "This is going to change everything." So the hard part is like, I can tell you something right now. I know I'm not going to be held to this. Um, I guess what I would say is, like, it kind of goes back to like a Markey and Dreesen, like software eats itself. Like I firmly believe that the healthcare system, no matter what happens in the next 2 to 5 years, per se, and past that, I don't know. Like there's still going to be a lot of the same components. There's going to be the physical delivery of care, and there's going to be more and more technology supporting, assisting, automating that work. And so, as long as we are staying as close to the cutting edge as possible, then we're going to be in great shape. Now, we have the benefit because we're not a product firm, we're a services firm. So, we just need to add value in terms of ensuring that our clients can leverage those products or utilize those products as best as possible. So, we do get to be slightly reactive. And that's a benefit, which then means, as the needs change of like the top health systems or the top biotechs or digital health companies, we will change to meet those needs so that they have a partner that they can trust. And yeah, our vision over the next 5 years is we want to 5X. We want to be, 5 times our size in many different ways. And there's definitely a market share that supports that thesis. And then it gets down to just the day-to-day in the trenches work and just executing, exhibiting that growth mindset, and also another one of our HCM values, which is grit, just showing grit.
Well, and grit's about determination. And recently, my mom's best friend from high school, she was 82. She just passed away, and I had the privilege of taking her on to some of her appointments, and just the peace of mind it gave her to know that when we got to the oncology, that she could get information from the hospital and that she could get it from her GP. And
Sure.
we didn't always have this, and
No.
so that's just I could tell that she felt secure knowing that when she went in there, she wasn't having to carry a paper chart or having to drive somewhere to go pick records. Because yes, I remember the day when
Oh
we
yeah.
had to do that.
No, 100%. I mean, when I started in 2010, I think the adoption rate was below 20%. I don't know the exact figure, maybe even lower.
Mhm.
And there was still hesitancy of the
Sure.
existing providers to even go
Mhm.
digital, which we can't even comprehend right now, because it just seems so inevitable. But it wasn't going to happen without the work that we do. And look, it's still not perfect.
Sure.
I I agree with you. Like, so many things are better now. There's still a long ways to go, but that kind of goes back to your last question of like, I see plenty of purpose for us. And what Greg and I used to talk about is like, at a certain point, if we're really successful, there won't need to be health data movers, right? All the data, it will all be existing. It will all be interfaced. It will all be queryable. Like, and that's a good thing, because that means that we'll all have better healthcare and better lifespan or WellSpan, and that's much more important than the company longevity, if you will.
Absolutely. I love that well span. I don't think I've heard that. So, speaking of well, I want you to think about you as your younger self. What words of wisdom would you tell your younger self?
I don't think we have enough time for that. I think that if I were to look back and tell myself anything, it would be just this notion of presence. It's going to be up, it's going to be down. But in the long run, like that doesn't matter as much as being there for those moments. And I think my mom used to always say, like, there's no dress rehearsal, like this is it.
Yeah,
So, enjoy the ups and the downs.
absolutely. Be present. Make every moment count. Tyler, this has been a pleasure. Thank you for your genuineness,
For
your
sure.
sincerity, and your enthusiasm. And I wish you and your organization much success for your future.
Awesome. Thanks so much, Mary Kay.